Cardiac Surgery, a guide for patients and their families. Dear cardiovascular surgery patient, on behalf of the cardiovascular surgical team, thank you for choosing Mount Sinai Heart at Mount Sinai Morningside for your cardiac care. Here at Mount Sinai Heart, we are committed to providing the safest, most effective, and most compassionate clinical care to optimize patient outcomes. Our cardiovascular surgeons are highly trained at the nation's leading institutions to expertly treat a wide range of cardiovascular surgical conditions. In addition, they have focused postgraduate training to achieve expertise in multiple cardiac surgical subspecialties, including complex all-arterial coronary artery bypass, robotic and hybrid coronary bypass, aortic and mitral valve repair and replacement, surgical treatment of atrial fibrillation and complex surgery for aortic dissection and aneurysms. During your hospitalization at Mount Sinai Heart at Mount Sinai Morningside, you will receive the highest quality care provided by an expert and compassionate cardiac team consisting of surgeons, anesthesiologists, intensive care specialists, nurses, nurse practitioners and physician assistants, social workers, technicians, and physical therapists. This dedicated Mount Sinai Heart multidisciplinary team has been trained to deliver the most advanced cardiac care and to meet the individual needs of every patient. We are relentlessly focused on two overarching priorities: safety and service. A member of the Mount Sinai Heart team will be available 24 hours a day, 7 days a week to assist you and your family through the process of your consultation, pre-admission testing, surgery, and throughout your post-operative hospitalization. Once again, thank you for choosing Mount Sinai Heart at Mount Sinai Morningside for your cardiac care. We look forward to seeing you. What is cardiac surgery? Coronary artery bypass graft is an operation on your heart or the vessels leading to your heart. It may require making new pathways for blood to get to various parts of the heart that have decreased blood supply. For valve surgery, there are 4 valves in the human heart: mitral, aortic, tricuspid, and pulmonic. Any one of these valves, due to the aging process and other medical conditions, can become stenosed, too narrow, or regurgitant, leaking. Valves are either repaired or replaced. Our surgeons have strong interest and exceptional training in valve repair. Your journey to cardiac surgery. Preoperative testing and surgical consultation. Tests that may have been performed include cardiac catheterization to detect blockages in the coronary arteries, echocardiogram to examine heart and valve function, routine blood tests, pulmonary function tests to assess how well your lungs are working, CT scans of chest, abdomen, and possibly the head. You will go over history and physical examination, meet your surgeon and other members of the cardiac surgery team. You will sign a consent for surgery. There may be more testing and consultation required based on your own particular medical conditions, and you'll discuss plans for your post-hospital care with a member of the team. On the morning of the surgery, you may feel nervous. This is normal. Your friends and family can come see you before surgery, and some may come to the preoperative holding room outside the operating room to be with you prior to going into the operating room. You will take a special shower and remove all of your jewelry. Please have your family take all of your belongings home. In the preoperative holding area, you will be brought to the holding area outside the operating room. IV lines will be inserted. Excess body hair will be clipped, and your skin will be prepped with special soap. You will then be moved into the OR. You will see the nurses, anesthesia doctors, and your surgeon. The OR is air-conditioned, and you will be provided with blankets. In the operating room, you will be put onto the operating room table. You will see many pieces of equipment and people arranging things for you. You will meet the anesthesia doctors, and you will be put to sleep. Cardiac Surgical Intensive Care Unit. You will be brought to the CSICU after your operation while still asleep. There will be the following: an endotracheal tube to help you breathe. Temporarily, while the tube is in place, you will not be able to talk, eat, or drink. Multiple IV infusion lines to administer medications. A tube in your bladder, or a Foley, so that you don't have to get up to use the bathroom. When you have pain, tell your nurse. They will get you some medication to help manage your pain. The nursing team will be right by your side. Visiting in the CSICU. For visiting hours, 2 people at a time may be at your bedside from Monday to Sunday, 9 a.m. to 9 p.m. No food or drink is allowed at bedside, and please, no flowers. Your recovery continues. You will be seen and cared for by nurses, doctors, nurse practitioners, physician assistants, physical therapists, and occupational therapists, nutrition and dietary consultants, and social workers and case managers. When you are ready to downgrade from an ICU setting, you will be transferred to the cardiac surgery step-down unit. Physical therapy after cardiac surgery. The roles of physical therapy include to help you restore functional independence in the hospital, to help you develop skills necessary to return to prior level of activity and social participation, and to get you back to your prior level of function or better. PT starts the day after your surgery. PT works with your nurse to help you start moving, getting out of bed and to the chair, gentle leg exercises, breathing exercises, and chest PT, and ambulating post-op day 1. Breathing exercises include an incentive spirometer, a chest PT for percussion and vibration, pursed lip breathing, and splinted coughing. Exercises for after surgery include seated hip flexion or marching, seated knee extensions, including kicks, ankle pumps, shoulder elevation, one at a time, and opening and closing your hands, which helps with circulation. For progressive exercises, you will practice getting in and out of bed, standing up and sitting down with the help of a staff member. You will advance to ambulation, and every day you will increase your distance. You may use a walker for the first few days. Practice going up and down stairs as needed. For the home PT program versus inpatient rehabilitation, remember, most patients go home after surgery. If medically and physically necessary, then we will discuss different rehab options. Physical therapy education includes home exercise programs and a walking program. Sternal or chest bone precautions, which are meant to protect your sternum after surgery. These include no driving for 6 to 8 weeks. Whenever possible, sit in the back seat to avoid airbag deployment. No lifting more than 2 to 5 pounds for 6 to 8 weeks. No pushing or pulling heavy objects. And use caution when moving your arms and trunk. You will progress through these activities, continue your pursed lip breathing, and stay aware of cardiac warning signs. You will learn energy conservation techniques, and we encourage you to continue breathing exercises and physical therapy exercises at home, and always follow your nutritional guidelines. Cardiac Rehab 101. Cardiac rehab doesn't change your past, but it can help you to improve your heart's future. It's a medically supervised program designed to help improve your cardiovascular health if you experienced a heart attack, heart failure, angioplasty, or heart surgery. Think of cardiac rehab as 3 equally important parts: exercise counseling and training. Exercise gets your heart pumping and your entire cardiovascular system working. You'll learn how to get your body moving in ways that promote heart health. Counseling to reduce stress. Stress hurts your heart. This part of rehab helps you identify and tackle everyday sources of stress. Education for healthy heart living. Managing your risk factors, choosing good nutrition, quitting smoking. Education about the heart healthy living is a key element of cardiac rehab. Attendance to cardiac rehab will be 6 weeks after surgery. Your healthcare provider, cardiologist, or surgeon will review your eligibility for the Mount Sinai Heart Clinic Rehabilitation Program. Getting ready to leave. Cardiac Surgical Step Down Unit 4 West. Here, you will continue your relaxation techniques, including coughing and deep breathing, walking and getting stronger, and any additional lines and tubes will be removed. Discharge planning. The members of your healthcare team will work with you and your family to make a safe plan for discharge. Part of your team includes a social worker who will work with you and your family to coordinate your discharge plan. The social worker will work with your insurance to arrange for necessary post-hospital care. Most people go home. Home care service can be arranged if needed. When medically necessary, arrangements are made for you to go to a rehabilitation center. Your discharge plan begins prior to surgery and is finalized during the last few days on the step-down unit. You will probably only be there 1 to 2 days. Coordinate with your family to have clothes, keys, and transportation in place. Discharge happens before 12 noon. Please advise your family. On discharge day, you will be given a discharge packet. The packet includes important information about your discharge, your prescriptions, discharge instructions, and phone numbers to contact us if you have any questions when you are at home. Contact information will be included for home care services and confirmed date of start of care. When you're at home, you must focus on pain management. You will have pain. We will manage your pain with an individualized pain care plan. This may or may not include narcotics, such as Tramadol, Percocet, or Dilaudid, and NSAIDs, such as Toradol or Tylenol. Cardiac surgery nutritional guidelines. Quick tips. Limit your sodium intake. Limit your saturated and trans fats. Eat more omega-3s. Eat more fiber. Eat more plant-based proteins. Limit your sodium intake. The American Heart Association recommends no more than 2,300 milligrams a day. More than 75% of sodium intake in the American diet comes from pre-packaged, processed, and restaurant food, not from the salt shaker. Just 1 teaspoon of salt is equivalent to 2,300 milligrams of sodium. Tips for reducing your sodium intake include limiting intakes of foods that are pickled, brined, barbecued, smoked, cured, or miso. Limiting condiments high in sodium, ketchup, soy sauce, relish, teriyaki sauce. Frozen and prepackaged foods are often high in sodium. Instead, cook with spices, herbs, citrus juices, or vinegars for flavor. Choose labels with low sodium or reduced sodium. When eating at restaurants, ask for less salt. And drain and rinse canned beans. These are some of the saltiest foods you can have, aka the Salty Six. Breads and rolls. Some foods that you eat several times a day, such as bread, add up to a lot of sodium, even though each serving may not seem high in sodium. Check the labels to find lower sodium varieties. Pizza. A slice of pizza with several toppings can contain more than half of your daily recommended dietary sodium. Limit the cheese and add more veggies to your next slice. Sandwiches. A sandwich or burger from a fast food restaurant can contain more than 100% of your daily suggested dietary sodium. Try half sandwiches with a side of salad with low sodium dressing instead. Cold cuts and cured meats. 1 2-ounce serving or 6 thin slices of deli meat can contain as much as half your daily recommended dietary sodium. Look for lower sodium varieties of your favorite lunch meats. Canned soup. Sodium in 1 cup of canned soup can range from 100 to as much as 940 milligrams, more than half of your daily recommended intake. Check the labels to find lower sodium varieties. Burritos and tacos. Taco toppings and burrito fillings can pack a Big sodium punch. Choose burritos and tacos that are full of veggies and have less meat and cheese. Limit your saturated and trans fat intake. Saturated fats include fatty meat, poultry skin, bacon, sausage, whole milk, and butter. Trans fats can include margarine, shortening, donuts, cookies, crackers, muffins, pies, cakes, fried foods, and fast foods. They're also packaged foods with hydrogenated oils. Instead of butter or margarine, try reduced fat whipped spreads. Eat more omega-3 fats. Omega-3 fats can include salmon, tuna, mackerel, and sardines, as well as walnuts, ground flax seeds, canola oil, and soybean oil. It can also include spinach. Look out for foods fortified with omega-3s. Eat more fiber. Include more fruits and vegetables in your meals and snacks. Aim for half of your plate to be non-starchy vegetables. Other high-fiber foods include whole grains, oatmeal, bran cereals, beans, and brown rice. Eat more plant-based protein. Plant-based proteins are lower in fat and often higher in fiber. This includes soy products like tofu, edamame, and soy milk, as well as legumes like beans, lentils, and peanuts.